If you've ever said, "I'm due April 12th," and expected your baby to show up on cue, girlfriend, I've got some news. I'm Dr. Rachel Miller, a board certified obstetrician and gynecologist. Due dates are helpful, but not nearly as precise as we pretend they are. In fact, only about 4% of people deliver exactly on their due date. That's right, only 4%. So, today on Miller's Medical Mondays, we're talking about what a due date really is, how it's calculated, why it's not a promise, and what I actually look at when a pregnancy goes past 40 weeks. Most due dates are calculated based on your last menstrual period, assuming a 28-day cycle with ovulation happening on day 14. But here's the problem. Not everyone ovulates like clockwork. Not everyone remembers their exact due date. And some people bleed irregularly or have longer or shorter cycles. That's why first trimester ultrasounds are so important. According to ACOG, which stands for the American College of Obstetricians and Gynecologists, if the ultrasound and last menstrual period differ by more than 5 to 7 days in the first trimester, we usually go with the ultrasound date. If you've conceived through IVF, we know the fertilization date exactly, so that's typically the gold standard. Pregnancy length is an average of 280 days, or 40 weeks from your last menstrual period. But biologically, term is anywhere from 37 to 42 weeks. That's a 5-week window. Actually, let me break this down just a little bit and give you some inside information. We OBs usually break down the word term, and we break it down into 4 types of term: early, full, late, and post-term. Early term is 37 weeks through 38 weeks and 6 days. Full term is 39 weeks through 40 weeks and 6 days. Late term is 41 weeks through 41 weeks and 6 days, and post term is greater than 42 weeks. This more accurately describes deliveries occurring at or beyond 37 weeks of gestation. Your baby does not have a calendar. They're responding to things like the placental function, hormones, genetics. And so when someone says, "Oh no, you're past your due date," you're not necessarily late. You may still be within normal limits. When we talk about the estimated due date, we're not just picking a random day to circle on the calendar. That date becomes an anchor for almost everything else we do in pregnancy care. For example, we use it to figure out the best window to offer genetic screening. Many of those tests are time sensitive and only accurate within a certain gestational age range. If the due date is off, you could miss that window or get unclear results. The due date also guides decisions about when to consider induction. If we're worried about the baby's growth or the birthing parent's health, we rely on that due date to decide when it's safe or necessary to deliver. Then there's how we define preterm, term, and postterm. Those labels, early, on time, or late, all hinge on that estimated due date. If the date's not accurate, those categories lose meaning, and decisions around safety and intervention can be thrown off. And finally, the big one, post dates. We don't usually like pregnancies to go beyond 41 weeks. But how do we know when 41 weeks is? That's right, it comes down to the due date. So while that due date might seem like a soft estimate, and yes, most people don't actually deliver on the exact day of their due date, it's a crucial part of guiding good, safe care all the way through pregnancy. It's a clinical anchor, not a countdown clock, and it helps us track whether fetal growth is on target across the trimesters. So while it's tempting to plan your nursery, childcare, or parental leave around that one date, don't be surprised if your baby rewrites the timeline. Let's just say it's 40 weeks and 3 days. You're tired, you're swollen, your text messages and DMs are full of, any baby yet? Here's what I think about next. Shortly after 40 weeks, if your pregnancy is planned to continue on much longer, we start post-date testing. The particular test can look different depending on the office you go to, so make sure you speak with your care provider to determine which one they use. Why do we do testing? Well, it's because the risk of stillbirth increases after 41 weeks. It's slow, but it does rise. That's why many OBs may offer elective induction between 39 and 41 weeks, depending on your cervix and hospital availability. Please keep in mind that a large factor in this is the hospital's availability for elective inductions. Some hospitals may not have the space to accommodate elective inductions. I've had a patient come in at 41 weeks in one day, just absolutely sobbing. And she said, everyone keeps asking me if I've had the baby, and I feel like I'm failing because my body won't go into labor. Her cervix was barely 1 centimeter, but she was healthy. The baby looked great. We did a gentle induction, and she delivered the next day, vaginally, and safely, and beautifully. The baby wasn't late. The baby was just ready on their own terms. For those of you learning the ropes, here's your takeaway. Due dates are a starting point, not a finish line. Know when to offer dating scans, and know ACOG's guidelines on changing due dates. And please don't say, you're overdue at 40 weeks or 40 weeks in a day. The language really does matter. We're building trust, not just tracking time. So if you're sitting there at 40 weeks and counting, just breathe. Your baby isn't late. They're just on baby time. Thanks for joining me on this week's Miller's Medical Mondays. If this helps you reframe your expectations or just feel a little less stressed, hit the like, subscribe, and drop your comments or questions in the comment section. I'll see you next week.